Global Healthcare Presentation, Italy. United States private health insurance. Private insurance is the primary health coverage for approximately 67% of Americans. Most employers contract with private health plans to administer benefits. Employer plans cover workers and their dependents, and the majority offer a choice of several different plans. Private insurance usually does not cover dental or vision benefits. Italy private health insurance. Majority of people in Italy acquire private health insurance. To access Italian national healthcare services, you must hold a valid Tessera Sanitaria, which is an Italian health insurance card. Foreign citizens are granted access to private health insurance with a stay permit. This permit allows foreign citizens to the same rights and treatment as any Italian citizen. Private medical services usually provide a more comfortable experience and better customer care. United States public health insurance. Federal taxes fund public insurance programs such as Medicare and Medicaid. Medicare is financed through a combination of federal taxes and mandatory payroll taxes. Medicaid is largely tax funded. 39 states provide dental coverage, and all states provide drug coverage. States Medicare. People enrolled in Medicare are entitled to hospital and patient care. There's two parts. Part A includes hospice and short-term skilled nursing facility care, and Part B includes coverage in physician services, medical equipment, and home health services. United States Medicaid. Medicaid covers services including inpatient and outpatient hospital services, long-term care, lab and diagnostic services, family planning, and transportation of medical appointments such as an ambulance ride. 47.83% of children receive Medicaid. 1.56% of pregnant women receive Medicaid. 7.53% of the elderly receive Medicaid. 16.99% of people with disabilities receive Medicaid, and 21.41% are working parents and adults that receive Medicaid. Public health insurance. Health insurance in Italy is primarily organized on a regional level. This provides universal coverage, including the full funding of public doctors and prescription drugs. Public services in Italy are very reliable. Public insurance users have to register with the Servizio Sanitario Nazionale, which is Italy's public health insurance system. All legal residents, this includes Italians and foreigners, have the right to public health care. Italians do not pay for a visit to their family doctor or pediatrician. Services through the public health insurance are usually free of charge. Public health care covers most medical procedures for all legal residents. Dental care is free in emergency cases and for all children up until 16 years of age. Prescription medication is typically subsidized, but may cost a fraction of the price depending on what type of medication. Treatments that require surgery or hospitalization in public hospitals are free of charge. The cost of an MRI in the US compared to in Italy. A full body MRI in the United States costs anywhere between $600 and $3,000, but it averages around $1,500 without insurance. With insurance in the United States, the average is usually between $100 and $300, depending on what insurance plan you may have. A full body MRI in Italy is between $500 and $2,000 without insurance, and with insurance, the average is typically around $420. Cost of an X-ray in the US compared to in Italy. For patients covered by health insurance, the cost of an X-ray is typically nothing or just a copay, which is usually between $10 and $15 in the US. Without insurance, X-rays typically cost between $260 and $460. In Italy, patients covered by health insurance typically only pay around $20 for their X-rays, and then without insurance, X-rays in Italy usually cost only $50. Cost of lab work in the US compared to in Italy. Patients in the United States not covered by health insurance pay anywhere from $100 to $3,000 for lab work, and that would all depend on what lab work they're getting done. With insurance, the cost normally just consists of the copay, so typically won't be over $30. Patients in Italy without insurance pay between $11 and $470, again depending on what test is needed and depending on where in Italy you are. Italians with insurance typically do not have to pay anything out of pocket for lab work.